Okay, thank you very much to Alice and Michael for your comments. I think in a very short period of time we've been able to capture the great breadth of the issues in this space. So as we transition to thinking about the future, I'd like us to take a look at GAVI's current sources of funding. This allocates IFM, AMC, and direct to all of the contributors over the past decade. And as you can see, it's a very European picture. And, of course, the Bill and Melinda Gates Foundation. Those are the big contributors here. Yet, herd immunity from vaccine-preventable disease is a global public good. This was one of the motivations behind the creation of GAVI in the first place and the Global Fund. And yet, the financing structure of GAVI doesn't reflect that all countries in the world do benefit from having certain levels of herd immunity for vaccines. There's no global tax system that a world government implements that would be, the rational way to raise money for something like GAVI. So we have to think of other ways to manage this. And I guess ideally we'd like to see countries above a certain wealth threshold contribute according to the benefits that they receive from herd immunity and the elimination of vaccine-preventable disease. And I'm working on this as part of a future global commitment to vaccination index. But in the meantime, I've carried out a very rough exercise that tries to look at fair share contribution to GAVI based on a country's wealth. So let's look at the current donors in terms of how well they did at contributing their fair share. So this chart is just subtracting a country's current GAVI contribution share from their share of global GDP. So at the top of the chart, we can see that the UK represents about 5% of global GDP, but 36% of GAVI funding over the past decade. They're contributing much more than their fair share. This is just the difference. So on the positive side, you can see that they're performing above where they would be expected given their level of global GDP. And at the bottom of the chart, my own country, the United States, where we're contributing about 28% of global GDP, but only 5% of GAVI financing. And the people and the countries in the middle are contributing about what would be expected given their share of global wealth. What if we asked G20 members to contribute their fair share to GAVI? What would GAVI funding look like? And think back to the first graph that I showed you at the beginning. So the US and Europe are still major contributors, more than half together. And I've put all of the European countries that are members of the EC together with the EC in this slide just so that you can sort of take out the purple and the red and then look at the other contributors. But what we can see is that China, India, Brazil, these are all countries that could be able to contribute to GAVI because they will perceive benefits and they do have theoretically the capacity to contribute. Of course, this is not net benefits, so we'll get to that later, but I just thought I'd put that out there as one possible argument to make when we think about U.S. funding for GAVI and also the role of health and global public goods on the G20 agenda. Thank you. So now let's switch to our friends from the GAVI Alliance. We'll start with Dr. Helen Evans and then David Ferreira. Thank you.